Hey class, it's Ashley Tharp, and I'm going to talk to you about a patient that was seen this week in clinic. This patient was a 24-year-old female G9P2 at 37 weeks and 2 days gestation who presented by EMS to the emergency room with no prenatal care and an active heroin withdrawal. She last used methamphetamine on March 25th, and she reported her last heroin use was day before the arrival to the ER, which was 3/27. She reported that she uses heroin daily by IV route, and that her withdrawal symptoms started the night before coming in. She had severe nausea, nonstop vomiting, and diarrhea. She was actively vomiting coffee ground emesis while we were in the room. She has chills and sweats. Her entire body was aching severely. She had abdominal cramping that was intermittent, and she rated as 8 out of 10 on severity. There was no leakage of amniotic fluid. There was positive fetal movement. So at the time, the baby appeared stable. However, that changed. Mom had her pregnancy dated by a 12-week ultrasound at a local hospital, but received no more prenatal care after that. She was awake and alert and oriented ×3, and it was also noted that she had an abscess on her right arm that she reported spontaneously started draining a few days ago, and she reported pus oozing from the wound. So that was assessed, and it was definitely draining and had some erythema around it. The patient has Hep C, but she was unaware of that diagnosis. So when we were actually talking to her about her substance use during the pregnancy, she reported that she'd been buying illicit Suboxone off the street and had been taking about 16 milligrams daily for control of her cravings and symptoms. She did report that while she was able to get the Suboxone, she did not use meth or heroin during that time. But she refused to answer what caused her to relapse with the meth or heroin, or how long she'd actually been taking the Suboxone. She did not ever be into an inpatient rehab or inpatient or outpatient MAT clinics or receiving any counseling, but was willing to go if we could get that arranged. And you can read more about that in my paper. She had a past medical history of anemia, gallbladder disease, heroin addiction, liver disease, and methamphetamine use. As far as surgical history, she had a few broken bones. She'd had a history of C-sections, her gallbladder removed, and multiple teeth extractions. Her family history was positive for COPD in her mother, cancer in her maternal grandmother, diabetes in her paternal grandfather, but no known health problems in her father, her maternal grandfather, or her paternal grandfather. Psychiatric mental health history was positive for known substance use disorder within the family, as her sister, brother, and aunt all suffered from that. No other known mental health conditions were noted. She was born and raised by both her parents locally until she was 13, when her parents divorced. And she reported that she lived with her father up until she completed high school. She now lives with her mother, who also has custody of her 2 daughters and her sister's children as well. So they all live there together. She denies any social needs at this time. She was very familiar to CPS, as she had open CPS cases in the past. She self-reported her drug use as heroin daily and methamphetamines often, but not daily, but for the last several years after she was raped at a party. She denied any other illicit drug use, so she had denied any cannabis, any benzodiazepines, no alcohol use, and she never smoked and doesn't use any smokeless tobacco. She couldn't tell us her longest period of sobriety, but said, quote, she has stayed high most of the last 8 to 9 years. She has a history of OD, and she's witnessed many ODs herself. So as far as treatment, you can read more about that in my paper, but the patient received a C-section due to repeated fetal heart rate decelerations and in utero fetal intolerance. She was started on buprenorphine 4 milligrams daily for opioid use disorder with active heroin withdrawal, and she was tolerating that well. As far as placement, after discharge, that was still pending. We're waiting for social work and CPS to collaborate with that. She had a referral for the wellness recovery team who was following her and managing her medically for the withdrawal, and she was placed with a peer support specialist. She was also being scored for withdrawal symptoms using the clinical opioid withdrawal scale, or COWS, and was receiving treatment accordingly for symptom management. Again, you can read more about that in my paper, and I appreciate it. Have a great day.